Hello, everybody. Welcome to the Bulletproof Your Back workshop, the virtual version. It's just easier rather than trying to record at the live events to go ahead and record it during a webinar version. So you're able to kind of look back through it. You also have me be able to talk through each exercise, each movement, each kind of assessment that makes it easier for you to follow through and follow along. So we'll just jump right into it. For those that don't know me, my name is Dr. Dy'Mire Jones. I'm a physical therapist and also a CrossFit Level 1 coach. And this workshop is meant to help decrease your back pain during your lifts. And just for a caveat and disclaimer, this is not seen to be medical advice. So if you are having any issues or if it's severe pain, please reach out to a healthcare practitioner and seek out their help and medical advice. This is 100% for educational purposes. So let's just dive into it. So a little bit of the background, as mentioned, it is all about getting you active movement and moving, decrease your symptoms, and to overall just build a healthier and stronger back so you can lift heavier and stronger weights and do these exercises for the rest of your life. So a little bit of the background is that the prevalence of back pain in CrossFitters specifically, based on the research, is around 40%. Okay, actually, it's probably higher. I would venture to say that most CrossFitters have some at least acute spouts of back pain, where we might have been coming off of deadlifts, or we might have had a lot of cleans, or something of that aspect, and you might have just dealt with acute spasm maybe for 1 or 2 days, or maybe even during the workout. But as far as it being a constant issue, anything past 3 months, the research shows that it's about 40%. So what are the primary culprits here, right? You have deadlifts, as mentioned. You have cleans. And also you have running for some people. As far as being what are going to be our solutions is, you believe it or not, more deadlifts, more cleans, and more running, but doing it in a systematic way that allow you to not only decrease your symptoms, but also build on top of the goals that you really, really want. So it's not heavier deadlifts, it's not heavier cleans, it's not more running, but being able to switch how we do cleans, being able to do different types of deadlifts, and being able to do any different types of running intervals or kind of tempo runs allow you to actually do what you love to do while also maintaining that movement pattern, but decreasing your symptoms as well. So who can help with this? Coaches, that's my primary referral source, and also who I primarily speak with when discussing athletes. I love other healthcare practitioners, but your coaches are those people that are primarily around you. As a CrossFit coach, I understand athletes tell me a lot more than what they would a normal healthcare provider. So reaching out to them is actually as number one source to figure out how to correct form, or if it's an issue, or how to decrease weight, or how to scale is easier than trying to ask someone who has no idea what's going on with the daily regimen for help. So, and that's a shot at my profession as well. Movement-based physical therapists such as myself. There are people out there in many settings, CrossFit gyms, performance art gyms, fitness studios, that are helping people just like you every single day. So I think we have some level of knowledge when it comes to actually treating that particular population, which is CrossFitters and runners and Olympic lifters and powerlifters. Other athletes, you'd be surprised how much I just sit back and listen to you all give each other advice and how to maintain and manage symptoms. So feel free to do that. And as long as it's really sound advice, I don't mind that at all. And other healthcare professionals, especially when dealing with insidious things, and we'll kind of get into that. But reaching out to them for blood work, reaching out to them for medication changes, if that's the case, to kind of see if we can't get some stuff kind of flushed out. It's super useful. So we've all been trying different things, right? So let's actually address the issue. So low back pain is very, very complicated. I would venture to say that it is probably one of the more complicated musculoskeletal things that's go on. But with that being said, it's highly researched, but no clear treatment. I wish I could say, hey, this is my prescription for your low back pain. There's actually no clear treatment, which could be looked at as a bad thing, but actually it's a really good thing because it makes us as the clinicians actually use our brain a little bit more and not just give a cookie cutter or an absolute approach to everybody. So I think that's pretty cool. There could be many causes to your low back pain. Muscle strain, like I said, that acute spasm or something going on there, ligaments, fractures, which hopefully we don't have any of those. Stress, you'd be surprised how much just stress and having that affects you during your workouts, and you're pulling a little harder, so thus you're not able to get the illicit response, and you just kind of have acute or kind of chronic back pain that never seems to go away. Postpartum activities for those coming off of pregnancy. Lack of sleep, again, just huge. I ask often, how often are you sleeping? What's your stress levels like? And changes in training volume, with it being a new year or going into a new cycle. Oftentimes people have just acute spasms due to increased training volume, or maybe even decreased training volumes, depending on how their body responds. And then repeated poor technique, not oftentimes the case, believe it or not, because everyone is slightly different. But if we can get some things kind of quote unquote turned on, it makes your pulls easier. It makes your deadlifts and your cleans easier. So why not go ahead and talk about that and address that? And oftentimes we do ignore these issues or just think that we can solve them really quickly, whether that be through medication or some type of external device such as foam rolling or massage or physical therapy or something like that. But they're not always easy to resolve. But we can have easy solutions to these that might take a longer time. So that's just something to note. So where exactly do you fit in? Right? Exactly. So these are oftentimes the question I ask. So you can ask yourself this: was it recent or acute, or was it more than 3 months? That kind of dictate exactly how we address it. Did you increase your training volume? Are you new to CrossFit? Is there any increase in particular movement? I know we have athletes that are oftentimes training for competitions, and when they look at the why, they all of a sudden start to turn into just cleans every day, or just pull-ups every day, or just box jumps every day. Is there an increase in a particular type of movement? Life factors, as mentioned: sleep, lack of sleep, stress, decrease in training days, so on and so forth. Improper technique, again, are we repeating the same motion over and over again? That, again, there's no such thing as perfect technique, but there is optimal technique that allow you to conserve energy, that allow structures to do what they're supposed to do, and allow you to have repetitive training volumes that elicit that response. Or are there any insidious causes? Again, this would be something that I would immediately refer out for. Are there any recent falls, severe pain, inability to get into testing position? Can you even get into a deadlift? Can you get into a running position? Can bend down at all, right? If anything, click, pop, or any kind of severe pulling, again, clicking and popping, there's nothing wrong with that. But if it's so auditorily loud, or if it's just severe pain when it happens, then we can start asking ourselves, okay, is this something that I can deal with on my own, or do I need another set of eyes, preferably a healthcare professional, to look at it? And with that being said, I kind of use the Big Four approach: mobility, stability, strength, and motor control, as a way to assess these. Once we roll out all the insidious causes or improper technique, all those, then I kind of shift over to the coaching / physical therapy side on my end to look at the Big Four. So we'll talk about those in some detail here next. So the Big Four. So as mentioned, mobility, stability, strength, and motor control. So I'll just talk about some definitions and as they pertain to this seminar here. So mobility, right? The ability to move into a position, right? An example of that would be internal rotation at the at the hips at the bottom of a squat? Do you have enough hip internal rotation in order to prevent that quote unquote butt wink as you're going down into a squat? Again, if it's at in range or all the way down, you're going to have a little bit of that. But if it's to the point where you're not able to get into that position or get down low enough to at least neutral or parallel, then we can start to look at some mobility being an issue. Ankle mobility as far as when it comes to overhead position. Are you able to have enough ankle mobility in order to sustain that squat as you go overhead? So that's just a few examples. When it comes to stability, do you have the ability to create the structural integrity throughout the range? Just a fancy term to say, are you able to maintain that position as you go through the range? And mobility and motor control can kind of stability and motor control can kind of look at the same, but we'll talk about some slight differences. So again, do you have hip stability during the ascending portion or the portion where you're coming back up from a squat, right? You need some stabilization at the hips as you drive your knees up, as you kind of straighten out your ankles, as you drive your hips up. Are you able to maintain that position, or are you falling over or falling back, and vice versa as well? Do you have enough lumbar stabilization in order to press yourself up coming from a squat? Strength, the ability to maintain load during the movement. Just simply put, are you strong enough to even lift that weight or repetitively lift that weight? If it seems like a 1 rep max each time you lift it, but you're supposed to do 5 to 10 of those repetitions, or maybe actually decreasing that weight and getting the illicit training response is better for you than to try to lift basically your 1 rep max 5 times. That's not necessarily a training goal, nor do I believe that results in long-term outcomes that we want. So an example of that is cannot lift the weight or maintain position throughout the movement. Again, the weight is so heavy that you're kind of breaking. Then you may not want to lift that weight, or you might want to just kind of slightly adjust it. And as far as motor control, the ability to maintain position throughout the range, again, could be looked at as stabilization. But you're moving slightly slower. Your position doesn't really change. A great example would be an overhead position. Are you able to maintain that thoracic or kind of trunk mobility while going down? But also, too, are you able to control that overhead position at your shoulders in a stabilized position in order to go ahead and come up from that squat? So it's a little bit of everything going on over there. A little stabilization at the shoulders, but mobility and motor control that needs to happen at the trunk level. So moving on from there. The assessment side of it. So this is where I jump in, a coach jump in, another athlete jump in, just to kind of assess everything, right? So there's multiple different ways you can actually do these tests. These are just a few that I picked that I actually are kind of my go-to and are just kind of easy to learn and easy to teach to others, especially in this format here. So as far as mobility goes, you have the hip hinge test, which essentially you have a 3-point PVC pipe on your back, which is going to be at your head, at your mid shoulder, then also kind of at the bottom area to kind of maintain that, or maybe the low back, and your hand is placed on the low back. You're going to press your hips back, and all these I have videos too. You're going to press your hips back, and essentially what you're trying to do is keep your bottom hand there on the small of your back and see if that either moves before you get at least 2 parallel, either flattening or pushing forward or pushing back, right? Like if your hands come off of it before you actually get the parallel, okay, maybe we're looking at a little bit of kind of some hip mobility that we need to address, so your low back doesn't have to move in that position. Not to say moving your low back is a bad thing. It should be able to you should be able to flex and kind of bend back. But if we can get the hips, who are the primary movers or the primary mobilizer at that point, to do their job first, then we may not need to actually bend our low back as much. Moving to the brace test, you kind of get into like a nice proper setup here. Looking at stabilization, and you could do this with some weights. You could do this with a kettlebell. I did it with a PVC pipe for simplicity. And you're just going to complete the deadlift movement or the clean movement, or anything that requires you to have a little bit of trunk stabilization. And then you're going to basically go throughout that range, seeing if you can maintain that neutral spine the entire time. You can also do this with overhead movements as well. All right. You have, again, the strength portion of it. You got 10 rep deadlift or squat max. If you are in extreme pain, or if you have something that is, bothering you when you get into these two positions, I don't recommend necessarily doing this, but finding just something that you can basically try to extrapolate numbers from. So if that's 20 repetitions at body weight, that's fine. If it's 15 repetitions at maybe half of that weight, that's fine as well. But just something to be able to take your numbers from, and I'll talk about exactly why that's the case. And then the break test, when it comes to motor control, you're essentially just going to do a Romanian deadlift or a regular deadlift and see if you break at the spine before you completed the movement. So you'll grab a heavy kettlebell, maybe even a heavy dumbbell, complete a deadlift or complete a squat, and see if you can maintain that neutral spine position the entire time. You're taking maybe somewhere between 15 and 20 seconds to complete the movement to see if your body can control that in a slower position, because that is a true test to our motor control. Looking at triage, right? So we've kind of diagnosed to some extent, or assessed and said, hey, I think this is what's going on. And just to take a step back, most people aren't just one thing, right? You may have some stabilization issues somewhere, some mobilization issues another place. We can all kind of get stronger in different areas. And sometimes if you slow us down, our body starts to shake, as in when I do anything that has to do with abs, like yes, you may have a six pack, but every time you do something with abs, it's like, woo, I kind of feel my body shaking a little bit. Okay, that talks about the motor control. So very rarely do people fit into one category, but you can kind of sparse out and focus in on that area. So, and these are some ways to kind of triage it and do some simple tests and treatment. So let's just prime the system real quick. Particularly we can address the hips, we can address the shoulders if we want to, or the thoracic spine, ankles, but we're just going to address the low back. So this is just a few things that I do to prime the system. So I kind of lean back a few times, put my hands at the small of my back, lean back just 5 times, going to my tolerance or where I feel comfortable, and then pressing myself back up. Vice versa, I lay on the ground, do kind of the same thing, pressing up 10 to 15 times there. And then I actually do a nerve glide test to kind of get some blood flow through the hamstrings, through the calf, through the low back, the sliding my sciatic nerve up and down the chain. Again, get some blood flow, oxygen, nutrients, kind of help decrease some of that irritation. So prime that up before I ever even get into my assessment or my triage portion. So for the mobility, we're in luck. It's basically the same drill. It's a 3-point PVC pipe drill. And again, I'm trying to keep my hand at the small of my back without breaking that neutral, rather it's going forward or going back, because I want to be able to use as much hip mobility as possible before I jump into a kind of lumbar mobility, which is perfectly fine. But if we can keep the hips moving before the low back, then we're in luck, because structurally that's what it's supposed to do. You're gonna go basically do 4 or 5 sets, 10 to 20 repetitions, and it should be in a pain-free range. If you're going down to probably around, let's say neutral is where you start to feel it at, or slightly before that, just go down there. There's no reason to force it, and then you just pop back up. As far as stabilization goes, you're going to do blow and go with kettlebell. Essentially what that looks like is instead of a Valsalva where you're holding it the entire time, which is what we often do doing a 1 rep max. For regular activities, you just kind of just need to breathe, right? You just need to do some things to create that stabilization at the spine and the other muscles around it. So instead of me taking a really deep breath, I actually take a small breath and then actually exhale as I start to be ready to lift the movement. So what that looks like is, if I was about to do a kettlebell deadlift, I'll be basically right over the kettlebell, kind of take a deep breath in, kind of an exhale there, and then I'll actually start the movement. That's going to just allow for me to create that stabilization at the core which includes the diaphragm, the pelvic floor, the obliques, the abdominals, and kind of the perispinals, the back muscles, have all those stabilized, and I'm able to kind of breathe throughout of the range of motion. So not holding my breath the entire time, but I have that stabilization there. So I'll actually do that if I'm breaking neutral when I'm doing deadlift. So it actually helps just keep everything nice and stable, nice and pressed out, but I can also breathe throughout as well. So what that looks like is a set of 4 to 5, 10 to 20 repetitions, and the weight is moderately heavy. So for our strength, again, 10 rep max. You're just going to do one set of that. That should be around 75% of your 1 rep max. And, oftentimes I take those numbers and extrapolate our movements from there. Most athletes work out around 75%, believe it or not. So not only is it a great test to just do because it's easier rather than trying to complete a 1 rep max, you can also take your numbers from there as well. So 75%, you can slide up to 85, 90, or you can go down to 70, 65 without ever completing a 1 rep max. So it's pretty cool there. Or if you are in pain with any of these movements, especially in the low back, you're going to revert to what is considered to be your re-1RM, which is going to be your rehab 1RM. So let's just say, for instance, you start to feel your symptoms when you deadlift, and I hate to keep going back to deadlifts, but it's just easier. When you deadlift 100 pounds, right? So let's say you feel something in your low back, like the run down your legs. It takes a few minutes to kind of get over that. Let's just say 100 pounds do that, but 90 pounds do not. Your re-1 rep max all of a sudden becomes 90 pounds. And I get it. Some of you all can lift 500 pounds without even breaking a sweat. That's fine. Kudos to you. But we're going to take that number at 90% and extrapolate all of our numbers from there. So that becomes your 1 rep max. And let's say, for simplicity purposes, you're supposed to do 50% of your deadlift. So that number's become 45 instead of 250. And then as your symptoms decrease, you start to slowly but surely climb that re-1RM up. So you climb up to maybe 100, 150, 200, and eventually the goal is to try to get you back to 500 pounds. Okay, so that's the way that you basically play your 1 rep max in order to build strength, but also to decrease low back pain and to kind of let your symptoms dictate how much weight you're going to lift, which is perfect. And then as far as when it comes to motor control, there's multiple different ways. I like to address it from a technique standpoint. So as far as a deadlift, and again, it's just easier to talk about low back pain and deadlifts. The way that I would do that, and I would grab a coach and kind of walk through all these movements just to kind of do a check with me to make sure I'm doing them the right way. I would say, squeeze your shoulder blades back, as you can see that I do here. Send them back down towards your pockets. You should feel like the mid-back muscle light up. That's your lats. We talk about them often, but you can actually use them on your deadlift to make your first pull easier. And then you're just going to rise your shoulders and hips simultaneously. So you'll reach down in that position. And instead of you standing up and kind of sending your hips up first or your shoulders up first, you're going to rise them up simultaneously while maintaining that shoulders back and then into your pocket position. I tell people all the time, the more muscles we have on, the stronger we are, the safer we are, and the stronger we are. And I figure if I put strong at the beginning and the end, people will hear that and forget about the safety part of it, which, again, goes all the way back to repetitive and being able to do these motions and do these for the rest of our lives and going from there. So here are a few of the movements. So you see me kind of retracting back there. You see me kind of sending my pocket, down towards the pockets. And then you see from here, kind of going down, maintaining that shoulder position. Perfect. Awesome. Good job. How can we solve these issues? So there's multiple different ways, right? So I would say the number one thing we could do is often people come in, you kind of hang out with your friends, we talk about last night's game, so on and so forth. But actually coming in and having a comprehensive warm-up would do a few things. For one, it primes your system to get ready for activities. Rather than jumping in and relying on the coaches to kind of do a general warm-up, I'm getting my warm-up in, my the things I need to do in order to prime my system to get ready for work. And that might look completely different than anything that we're doing, but these are the things that I do to help calm down my low back symptoms when I am having them. Or even if I'm not, it's a good just overall warm-up plan. So again, they're used to decrease symptoms. Again, it helps to kind of prime system prior to exercise, get things calmed down at the nervous system level. And then it also helps smaller muscles, creates a mobility in my hips, right? Create some level of stabilization, build strength in the short term, right? Or at least kind of get things warmed up and active and ready to move. And then it helps just work through things in the motor control setting. In the low back, those things look like prone press up, glute bridges, PVC Superman holds. For some, that looks like kettlebell. For the hips, it's kettlebell single leg RDLs and single arm carries. Just again, kind of getting things primed up at the hips. All these are just going to be supportive tissues. If you're strong at your hips, your low back has to do less. If you can mobilize at your hips, your low back has to do less. So, kind of priming those systems and getting them stronger and getting them to do their job makes everything easier for you. Hamstrings, again, RDLs with kettlebells, some Nordic curls, also some nerve glides. Again, just getting that sciatic nerve flossing up and down can help decrease symptoms like the low back and the hamstrings, and thus just getting, more and more muscles, activated and loosed up and ready to do their thing. So you need basically a 6-week comprehensive movement program, which is, something that I recommend, again, to decrease symptoms, increase performance, increase tolerance of the low back for some, and then increase strength of the lower body lifts, and also increase PRs without fear of re-injuries. So this is more than an exercise program. It overall creates independence and longevity. And what it looks like is basically 2 weeks of priming the system and calming down things, system and calming down symptoms. Sorry about that. 2 weeks of basically building tolerance and strength, which is amazing. 2 weeks, you basically just kind of hammering out things and getting pretty heavy with lifts, but you've already done all the legwork with getting things calmed down, so it shouldn't be an issue. And basically how that looks like some explosive return to kicking butt after sport, right? And what that looks like is, let's say if, cleans was your number one issue, then get him at the cleans, heavy cleans, explosive cleans, and just going from there. So that's just my recommendation when it comes to a lot of this stuff. And that's kind of how my treatments are set up as well. Somewhere between a 6 to 7 week aggregate, whether we're skipping weeks or not. And it looks amazing actually when you see it play out, or when I see it play out when someone kind of doing their own independent program. Is pretty cool to see. So how can I specifically help, right? So you can come see me as a physical therapist, one-on-one session with Dr. Physical Therapy. That's me. I don't have any techs or aides or anyone like that helping me out. So it's just me and you kind of going through things. It's goal oriented, and that's whatever goal that you set for yourself. So if it's wanting to handstand walk, if it's wanting to get back to deadlifting heavy, if it's starting to run again for a marathon, whatever that goal is, we'll do things to calm down your symptoms and get you back to doing what you love to do. Focus training on patient goals, as mentioned, and no surgeries are guaranteed. And what that looks like is basically 50 per session if you aren't a CrossFit athlete, and then 135 per session if you are a CrossFit athlete. And I'll put all the details in at the end of this webinar. Ironclad Back, which is that 6-week program I was mentioning, that comprehensive program. Again, 6 weeks. Decrease low back pain, as mentioned. Build tolerance in the low back. It gets you back to hitting PRs, which is amazing, which is my number one goal as a therapist to get you to do. And build longevity and independence. So what that looks like is basically $37. You have that program for life. You are put into basically my low back email list as well, so you get really cool exercises and follow up with me and get all kinds of cool and special things, and then get to go from there. And what that looks like, because you are listening to this webinar, is that's $37 for you. And yeah, or you can be part of one of my online Physio Plus programs. So that's a couple of different things. So they're monthly programs that build strength and mobility. The comprehensive focus, again, looks very similar to the Ironclad Back, or to the integrated therapy. They kind of allow you to work around your pain. Get you back to doing what you love to do. A lot of percentages, a lot of different activities if you are getting back into it, and it's actually pretty cool. So you hit all the small stuff, and then you get to go from there. What that looks like is $17 a month, or $27 a month with lifting assessments. If you want me to kind of go through using different platforms and different apps to kind of look at form and make sure you're doing everything's correctly. And especially if you're one of those ones that want to build performance up, you can always just kind of click on that, see that, and then go from there. So thank you for watching this webinar, watching this seminar. Essentially, again, if you have any questions, please contact me. There go my number right there, or just email me. If you have any questions, please feel free to reach out to me. Let me know what you are, kind of what you're thinking, kind of what you want to do. And then go from there. Again, I'll have all the information as far as pricing, as far as different, all the emails and links for you. But yeah, I hope that you all enjoyed this webinar, this seminar, and I hope that I can help you to decrease your back pain and get you back to doing what you love to do. Have a good one.